on Locked On Women's Basketball, I am joined by two physical therapists, and we're going to get into injuries in women's basketball and how to prevent injuries in the WNBA. This is Locked On Women's Basketball. Today's episode is brought to you by FanDuel. Right now, customers can get $200 in bonus bets when your first $5 bet wins.
You are Locked On Women's Basketball, your daily podcast on women's basketball. Part of the Locked On Podcast Network, your team every day.
Hello, everyone, and welcome to this episode of Locked On Women's Basketball. I'm Chelsea Leite of The Next, and I'm joined today by two very special guests. Hannah and Lucas, they're both teammates over on The Next, but they also have a great background in physical therapy. So I'll throw it to both of you first and maybe just give a background on, what your job is, what your expertise is, and then we'll head into our conversation. So let's start with Hannah because you're the one right next to me.
Sure. Thanks for having me. I am a physical therapist. I got my degree from Nova Southeastern University in Fort Lauderdale. I currently work in inpatient rehab in an accredited stroke and brain injury center, but I did a little bit of work with sports along the way, and I was a Division II college athlete.
Awesome. And Lucas?
Yeah, so I got my physical therapy degree from the University of South Dakota. I also got my PhD in kinesiology from Concordia University in St. Paul here in Minnesota. My day job is as a assistant professor in the exercise science department at a small college in southern Minnesota, but I also do some practice on the side, specifically in the orthopedic kind of outpatient clinical sports realm, that kind of stuff. And my PhD dissertation was on basically injury epidemiology in the WNBA.
Incredible. So obviously you can tell by those explanations that these two know way more about injuries and physical therapy and science in general, I guess, than I do. I'm just a writer. So I thought it would be fun to bring our experts together. Injuries are such a hot topic in the WNBA right now. We have so many players that unfortunately are out for season injuries, who are not out for the entire season, but struggle with injury. And it just seems a little bit more common in women's sports than men's sports. And maybe just because we're kind of in this vacuum, but every time there is a big injury in the WNBA, you two are the ones and a few others on our next team who end up, just kind of explaining what these things mean, being the voices of reason, telling us, even just kind of like breaking down what the reports are saying, because sometimes they're a little bit vague. So I'm excited to kind of dive in. And let's just dive into that. From your perspective, we'll start with Lucas this time. What are the most common injuries when it comes to women's basketball athletes?
Yeah, so whether you look at previous research that has been done in the field, or look at my dissertation project, it's pretty common that we see the most injuries in the knee, the ankle, and the foot. And if you compare that to whether it's women's basketball at the collegiate level or even men's basketball, those are generally the three most common areas where we see injuries. Now, the specific injuries that occur at those joints are a little more nebulous in the WNBA for a bunch of reasons that may or may not go beyond the scope of this podcast. But those are the joints you're kind of looking at. So you're looking at ankle sprains, knee sprains, maybe broken bones in the foot or sprains in the foot. ACL is always a hot topic in the knee, meniscus in the knee, that kind of stuff is what we're looking at.
Yeah. And, Hannah, is there any is this different than male athletes? Do you typically see a little bit of a difference in what's coming in from women's basketball athletes to male basketball athletes?
Yeah, there are definitely some gender specific risk factors. This can go anywhere from, anatomical, biomechanical, hormonal, and we're going to talk about that a little bit more later, but definitely there's a couple of risk factors that women have that men just don't, and that's typically why we see kind of that increase in women. They're about 2 to 8 times more likely to experience an ACL tear than a male athlete, simply for those risk factors.
Yeah, we see that in the media as well. Like we see that in these players that it seems like at least like a couple of years, this year kind of feels like a little bit more players end up out with that ACL injury. And, you know, maybe just throw like this one's a little bit of a wild card, but like the ACL in general, like, is it just like a weaker ligament in comparison to the other things in the knee? Because I know the knee is made up of like a bunch of different ligaments.
Yeah, so the ACL, I wouldn't necessarily say it's a weaker ligament, but I would say it's put in a precarious position, maybe compared to other ligaments in the body. So the way I like to think of it is, you look at the knee. There's kind of four major ligaments that help stabilize the knee. So you have your ACL and your PCL, which are located inside the knee, and then you have your MCL and your LCL, which are located outside of the knee. And basically, the ACL, its primary job is to make sure that the tibia or your shin bone doesn't move too far forward compared to your femur or your thigh bone. And what we see is when that ACL gets injured, it usually happens in a couple of different ways. Basically, either that tibia moves too much relative to your femur, or there's a twisting component. And in a lot of times, it's kind of both of those mechanisms. And the ACL also kind of protects against too much rotation. So it's also angled kind of diagonally within the knee. So it's just a bunch of different factors that basically just make it so that it's exposed to a lot of force during athletic activity. And whenever you're exposed to a lot of force, you're just more likely to have an injury because of that.
Yeah. And, you know, because obviously, like, there's probably not too much of a difference between the actual ligament when it comes to men and women. But Hannah, why do we see, like you said, that statistic, there is, you know, much more likely of a chance for women to have this happen than men? Is there a reason for that, or are they still trying to like figure that out?
Yeah, so we'll kind of start with the anatomical differences. I mean, there's something called a Q angle, which is essentially the angle between your hip and your knee. With women, we have wider hips because we bear children. So typically, what that means essentially is that the angle is going to be larger in women than in men. So how that translates to the ACL is a greater lateral force is being put on that knee joint than in a male. And to piggyback off what Lucas just said, any added force, you know, the ACL only has so much capacity. So any added force, an ACL injury is essentially just an overload of its capacity, or it's, you know, I don't know the specific number, but there's what it's able to handle. So when there's a lot of force put on that, you know, and if it's overloaded, you're going to see a tear. The severity of the tear will depend on how much it's overloaded. So again, going back to that kind of Q angle in women, because it's larger, they have, you know, a larger force being pulled laterally or to the outside than a man, which does impact the integrity of the ACL.
Wow. I didn't know that. That's wild. I mean, I'm just like sitting here like absorbing all of this, which is so great. I think that's such like an interesting thing to talk about because, you know, we always talk about how, you know, men and women, you know, we can do anything, especially when it comes to athletics, you know, trying to be seen as equals, but realizing that there are those anatomical differences that like really do affect things. And it's not just like it is sometimes a luck thing, but a little bit more of, you know, something to do with anatomy than it is to, you know, the actual, just like playing of the sport and stuff. So yeah, that's really wild. And, you know, of course we've talked about ACL injuries, but Lucas, my question is, you know, is that actually the most common injury in women's basketball, or, you know, is that just kind of what we're seeing based on like the media representation of it?
Yeah, I would say it's not the most common. It is among the most common knee injuries that we see in women's athletics at all levels and in all different sports. But if you're, you know, asking me what is the most common injury that we see, it's probably going to be like ankle sprains are the the most common. I can look at my data here from the project real quick. Let me just pull this up. So when we're looking at ankle injuries with from the 2023 season up until our recording here on May 21st, there's been 77 ankle injuries. And that's by far the most, compared to 56 knee injuries. And then actually the third most common injury, so to speak, is just general illness. So lateral ankle sprains or outside ankle sprains are the most common. They also tend to be significantly less severe than knee injuries or ACLs for sure.
Yeah, I guess like the factor that makes it seem so much worse is the fact that as soon as you tear your ACL, that's like a year gone, right? Whereas like ankles and stuff, you can rehab a little bit faster. Okay. All right, that is super interesting. So we're going to take a little bit of a break. When we come back, we're going to specifically talk about injury prevention and, you know, steps that the WNBA can take to prevent these injuries that we've been talking about. So stay tuned. This is Locked On Women's Basketball. The NBA playoffs are in full swing, and every night delivers highlight-worthy performances, major momentum shifts, and can't-miss moments. Whether it's a game-winning shot or a breakout player, there's never been a better time to get in on the action. FanDuel makes it easy to stay in the game before tip-off and live. With player props, performance trends, and same-game parlays, fans have more ways than ever to play smart and win big. You know, the NBA playoffs are so wild. Things change every day. You really never know what's going to happen. And so the fact that you can just bet minute by minute with FanDuel is really cool because, you know, no matter where the game goes, you can make sure that you are still up to date on your parlays, on your games. Are you new to FanDuel? It's a perfect time to sign up. Head to FanDuel.com and place your first $5 bet. If it wins, you'll get $200 in bonus bets. Make every moment more with FanDuel, the official sports betting partner of the NBA. All right, we are back here with Lucas and Hannah. We are talking about injuries in the WNBA specifically because, you know, of course, this is a women's basketball podcast. And the thing that seems to come up whenever an athlete suffers, whether it's a season-ending injury or an injury, is just like, oh, there's so many injuries. How do we prevent this? So let's start with Hannah. So when it comes to athletes, like what are some of the day-to-day things that fans don't see or realize that they're doing to prevent injury?
Yeah, so rehab goes on, you know, before the sport, after the sport, during the sport. I think consistency is a really big one. So sometimes, you know, what fans don't see is the amount of work that they're, you know, athletes arrive to the gym oftentimes, you know, 2 to 3 hours before they're supposed to be there, simply to just get their treatment, go through their warm-up routines. I think something important to note with athletes and prevention overall is everything is going to be very individualized. So we want to be looking at their individual risk factors and what they need for their body. Do they have pre-existing injuries that is going to impact their warm-up? Do they need to have extra time? For example, if somebody had an Achilles rupture that they're recovering from, do they need to spend a little bit extra time before they warm up, working on ankle mobility? So I think something that we really just need to take into consideration when it comes to prevention is make everything individual and look at that athlete as a whole, and what can we be doing to better, you know, gear their program to their needs.
Yeah. And I mean, Lucas, kind of the same thing. Like, have you noticed any specific things that Hannah might not have mentioned that, you know, players are doing either before games, after games, during games, like to prevent, like specifically to prevent certain injuries?
Yeah, so the tough thing with injuries is that they're very multifactorial. And I think that kind of almost even underscores how like complex injuries are. So when it comes to preventing injuries, one thing that I would say is like it's very difficult to actually prevent an injury. Like they're going to happen in sports, but there are certain steps that we can take in order to reduce the risk that an injury might occur, especially when we look at the global level. So like across the WNBA versus specifically at a one individual athlete. But like everything Hannah said is correct. Like you want it to be as your treatment program to be as individual as possible. And a lot of things that people maybe don't know is that a lot of teams will do like strength and conditioning after a game, especially before they like go to let's say they play a home game and then 2 or 3 days later they play an away game. They might do a lifting session like immediately after their home game before they get on the plane to get to their next game, just because there's just not a lot of time to get that in. So especially during the season, trying to maintain an athlete's strength can be very, very difficult, especially in a schedule that's as compact and as loaded as the WNBA season. You know, we're up to 44 games a season now, and that transition has happened pretty quickly, but the actual like number of days in which the season occurs has not increased commensurate. So now there's even less time for that kind of stuff compared to what there was, 2-3 seasons ago.
Yeah, I mean, you're exactly right about that. And I know you said, it was funny, you said, they work out after games, and there's kind of that taboo of like, filming the workout after the game and the whole like winner's work thing, if you're familiar with that. But yeah, I mean, I know it's definitely hard, and there's a 44, like you said, 44 games in the span of just a few months, and then sometimes there's international tournaments as well in the middle of these seasons, and so players are going through different time zones, going to different like leagues, different teams. And especially with the WNBA, like these players usually they'll play in the WNBA and then they'll go right to an overseas team, and then they'll play right until they have to come back to the WNBA. And even the players that have opted not to go overseas, they're still playing in things like Unrivaled and that as well. And I mean, I think it ends up, if I don't know, have the exact number of days, but it probably ends up being more days of playing than like an 82 game NBA season, obviously, because the NBA players then will have sometimes like April to like September off, or if they make it into the playoffs, May-ish until they come back. And so, yeah, it's interesting to see the dynamics of how that works when they play all year round, as opposed to getting an actual off season. And so, like, just like in your opinion, do you think that has been a huge factor in some of these players deciding not to go overseas?
I think it is, for sure. And I think that was a major impetus behind Unrivaled. It was to think, okay, can we keep some of these athletes in market where they're making, as much money as they would, or, roughly equivalent as they would overseas, but have less of a strain on their body playing less games. Now, the 3-on-3 basketball is a lot different than 5-on-5 basketball, and again, that's a conversation for a different day.
Yes.
But I think that's a big reason. The WNBA Players Association really should be pushing for that. It comes out in the way of increasing salaries, which obviously, it's no surprise that needs to be done. But increasing salaries will allow them to not have to play year round, which might reduce, injury occurrence. It's tough to say without actually having years and years of data. And until that gets implemented, we can't really say for sure, but it's logical at the very least. Yeah.
And I mean, Hannah, are there other steps? Obviously, that was kind of one thing that the WNBA could do to try and prevent injury, making sure players can have a lengthy off season. But when it comes to, like we were talking about, those broad, like global things, when it comes to a league-wide thing, is there other things that the WNBA could do and implement to try and prevent long-term injury?
Yeah, I mean, Lucas can probably answer this a little bit better than I can, but I think just from a physiological standpoint, kind of as he touched on, implementing as many rest days as possible and just reducing the amount of impact and load that's truly put on their bodies. These athletes are the best of the best, and they train at the highest level, and we're still seeing a large amount of injuries. So I think Lucas kind of said this in the beginning, injuries are inevitable. We can prevent, but we can't prevent. So just kind of leaning into the research and doing a deeper dive, I think, and really looking into the data behind this stuff, and just finding a way to overall balance it out a little bit more between like work and rest.
Yeah, and I mean, a big topic in the past few weeks has been roster expansion, with 11 to 12 players currently on a WNBA roster. And I mean, once they kind of get down below 10, they can sign hardship contracts and that as well. But do you think, Hannah, that expanding the rosters to say maybe like 14, 15 players would maybe help lighten that load on some players?
Yeah, I mean, of course, we always want more players than not. There's just so much talent within this league. I think, the development league is, again, a topic for another day, but that's even something to think about on how we can shift. There's a huge shift in physicality from going from college into the WNBA. So even if we can kind of bridge that gap a little bit more, going back to what you said about expanding roster space, yes, the short answer is yes. A lot of the times when athletes are returning from injury, you see them with limited minutes. And again, that is just to kind of prevent the amount of impact and load that they're going to be experiencing. So yes, I think roster expansions would really play a role in, again, limiting these players' minutes, giving them more of a balance and kind of stretching that out a little bit.
Yeah. And I mean, this one's a little bit of an off, like maybe a specific example, but it just kind of popped into my mind before we head into the next segment. We talked about those knee injuries and the fact that, some of them, once you kind of get a knee injury and surgery, sometimes it takes like a year. But, in the case of recently, Brianna Stewart, Kalia Copper, we've kind of seen what they are calling like a scope. And maybe this is more just like, because I'm curious too, like what is the difference between that kind of surgery and injury and like a full blown like ACL repair?
Yeah, so a lot of times when people, like when it comes to reported that an athlete had a scope on their knee, essentially what they're most likely had was they had what's called a partial meniscectomy, which is where you go in and you take out some of your meniscus, and then that tissue doesn't grow back. But the reason why it's called a scope is because it's not an open surgery. So open surgery means like they take a scalpel and they cut you open kind of thing. A scope is basically they just poke a little hole in your knee and put a camera through it in one hole, and then another surgical tool in the other hole. So it's the term that they call it is minimally invasive, meaning you don't have a really big incision. It's just a little like hole that they poke into your knee. Those types of procedures tend to have better outcomes than full open procedures, at the very least, because there's much reduced risk for infection. And a lot of surgeries these days are actually done that way. So partial meniscectomy, depending on the surgeon, I've seen some ACL repairs that are or reconstructions that are kind of going that way, instead of having the big old scar on the front of your knee, that kind of stuff. So when it comes out and report, they had a scope of their knee, basically means they probably had a partial meniscectomy.
Yeah. And like when it comes to, so you said like they shave off part of and you said it doesn't grow back. Like what's the point of that, I guess?
So good question. So in adults, the meniscus has really poor blood flow. It's basically just the outer 1/3 of the meniscus has blood flow. So in our knee, we have two of them, one that's shaped like a C and then one that's shaped like an O. So basically just the outer portion of that C has blood flow. So if the tear is small enough and is located on that outer portion, it may or may not regrow. But most of the time the tears happen somewhere else, or they're too big to the point where they can't heal on their own. So in some people, that tear might flap over and then cause their knee to like lock or catch or cause pain with twisting and that kind of stuff. So if you go in and you cut out that part, it doesn't happen. The issue is we now have less cushioning in our knee. And part of the reason for the meniscus is to provide basically a vacuum seal and some stability for your knee. So if you go in and you take a piece out, we now have less cushion and potentially less stability. And that can increase the risk for like arthritis. The upside is you get to come back to play in 4 to 6 weeks. The downside is you could develop arthritis later on in life. Now, if you can actually repair the meniscus tear, the upside is your risk for arthritis decreases dramatically. The downside is it takes 4 to 6 months to recover from. So that's kind of the anytime an athlete has some sort of surgery, that's the cost benefit analysis they're looking at, or what are my long-term outcomes and how quickly can I get back to play.
Yeah, wow, that's so interesting thinking about they just like chop off a piece. They're like, okay, you're good to go. And when we come back, we're going to kind of talk about kind of the advancements in women's sports medicine. There's kind of been a few things coming out in the news, so I wanted to get your opinions on that. So stay tuned. This is Locked on Women's Basketball. All right, we are back here with Lucas and Hannah of The Next, and we're talking all about injuries. One of the things that has really interested me in the last couple of months is that they've announced these very like women specific, just kind of like research studies on, you know, women's health, women's injuries, sports medicine. And I'll throw it to Hannah first. Have you seen any, what are the biggest advancements in women's sports medicine that you've seen and noticed, especially over the last few years as women's sports have experienced this like big boom in pop culture?
Yeah, I think one of the things I think you're referring to is the research they're doing on menstrual cycles and hormonal levels impact on ACL injuries. But there's also a study that I recently reviewed which looks at movement patterns and sport-specific risks. For example, there's 5 sports that typically you see more ACL tears associated with. And those, for women, those are going to be soccer, basketball, volleyball, field hockey, and lacrosse. The reason being are the movement patterns associated with the sport. We kind of touched on this earlier, but there are certain demands and there are certain positions and combinations that do tend to stress the ACL and the knee joint more than others. And those 5 sports do typically utilize a combination of those movement patterns. So I think to answer your question, one of the things and advancements is how can we look at movement patterns and how can we alter them and really study them to make sure that we are not putting those athletes in those compromising positions to overall increase their risk of injuring, something like their ACL.
Wow, yeah. And I mean, Lucas, is there anything that you've noticed maybe specifically to the WNBA or maybe, through your research of things that they're doing to like advance the knowledge and what they know about women's sports injury specifically?
Yeah, the short answer is not enough. When I was looking at my research project on epidemiology in the WNBA, there had only been 4 other studies that had ever been published looking specifically at epidemiology, which is just what are the injuries that are occurring in professional women's basketball, specifically the WNBA. Yeah. Now the studies that tend to get all the headlines, like you had mentioned, are the ones that look at things like the menstrual cycle's effect on injury. And that really comes from a background of, hey, women tend to suffer more injuries. They also tend to have more estrogen, so it must be the estrogen's fault. And some of the earlier studies that were done that maybe weren't the most robust did tend to show that there was potentially a link there. Yeah. And I can provide a recent systematic review that was just published in the American Journal of Sports Medicine that we can maybe put in the show notes or something like that.
We can put it in the description below.
Yeah, basically said like, hey, the evidence doesn't seem to back up that estrogen is as impactful as we used to think it was. Because essentially, to break down the study very quickly, is that when we look at the tissues that make up the body, there are receptors for the estrogen hormone in all of these different tissues, muscles, ligament, tendon, what have you. So the thought was that during the menstrual cycle, as estrogen increases, we would therefore have more estrogen attaching to these structures and then increasing the risk for injury. But we don't tend to see that happen. The injury rates, if you look at studies that look at people that are going through the menstrual cycle versus those that are not, the injury rates aren't increased. Another kind of theory that was going around is that particularly, again, during the menstrual cycle, the female body will release a hormone called relaxin because during the birthing process, you need your ligaments to be relaxed, so to speak, so that the baby can be birthed. So the thought was, okay, if the hormone is being released during the menstrual cycle, that will cause the ligaments to be weaker and therefore cause more injuries. And there seems to be maybe some evidence of that, but again, not as strong as we used to think. So when we're looking at women's, studies for injuries in women's sports, I think what would be super valuable is kind of transitioning away from studying things like estrogen and relaxin and more to things like Hannah was saying, like movement patterns or how, one thing that I like to harp on a lot is did these women play, did they specialize in their sport at a very young age? Did they play AAU year round starting at age 12? How does that implement injury, or how does that increase injury risk later on in life? How strong are these athletes? I think one thing that, if you look in the research, is it kind of sounds like a muscle head way to think about it, but what are the things that protect our joints? Our muscles. And the research is pretty set on this, is that a stronger muscle does a better job of protecting your joints and your ligaments and your tendons and your muscles than anything else. So are we doing enough strength training? I think the answer is no. But again, that's a topic for a different time. So, I think looking at things like that, like how can we adjust movement patterns? How can we adjust strength and conditioning programs? How do we convince 10, 11, 12-year-olds that you don't have to play basketball year round to get a Division I scholarship or to go pro? I think those things would have a lot more of an impact on reducing injury risk than studying estrogen again.
Again, yeah. I mean, that's interesting too. And I mean, from my like normal person perspective, the idea that like hormones have something to do with it, like at first you're like, oh, okay, that makes sense. And then you think about it more and you're like, everybody is so different when it comes to how we experience these cycles, the timing of them, what they do to our bodies. A lot of these women are on birth control, all of that stuff, right? So that like obviously contributes to that as well. So I definitely agree. Like not enough research. We need more research, and to like stop doing it specifically on these things that, we've kind of noticed aren't really taking as much effect as say like movement patterns or like, anatomy and stuff like that. I'm still like the whole thing about the hips and the angle, like that blew my mind, Hannah. So thank you for that. But
and, Chelsea, the reality is my hot take on ACLs is, you can look at the hormone levels, you can look at the anatomical factors, you can look at, the biomechanical factors even, but sometimes the dots just align, the stars connect, and you just have that perfect deadly combo where that, ACL is overloaded, and there's just, the ACL is such a unique injury because it can happen contact and non-contact. Because all it is too much movement of one bone on another, and that ligament gets pulled. So.
And like I was saying earlier, to piggyback on what Hannah's saying, is when we say multifactorial, it's like, I think when people think that word, they think maybe like two factors, 4 factors, when really it could be like hundreds of factors that each contribute 0.01% chance of an ACL rupture at any given time. And on a certain day when the stars align, you could do everything right and still have an ACL tear. So again, that's where I think the focus should be on, not necessarily as how do we prevent this individual athlete from tearing their ACL, but how do we reduce the overall amount in the general population or in the broad population. And that's where you talk to any scientist, the thing that adds complexity in science is variables. And when you're looking at injuries, you could control 2, 3, 4, 5, 10 of them, but there might be 100 that you can't control.
Exactly. Yeah. I mean, with a lot of things in life in general, sometimes you just can't control it. And I think that's the frustrating part sometimes when these athletes are on, their trajectory and they get stopped by that. So I think that's like the biggest lesson to take, is that we can do all this research and we can do all of this stuff. But like we were saying in the beginning, injuries are going to happen in sports, and that's just a part of it. But I mean, thank you both so much for taking the time to talk to me. Thank you so much for making us your first listen of the day for this episode. I'm Chelsea Leite, and we will see you next time.